The Trump administration just said nursing isn't a professional degree. I'm not even fucking joking. They released a list of what counts as a professional degree for student loans, and nursing didn't make the cut. But you know what did? Let me tell you, because this is fucking wild. So this is part of the big, beautiful bill, and they had to redefine what counts as a professional degree because that determined if you can get a $200,000 in student loans or if you're capped at $100,000. Here's the list of what qualifies: medicine, pharmacy, dentistry, law, veterinary medicine, osteopathic medicine, dietary, chiropractic, theology, and clinical psychology. You see nursing on that list? No. Physician assistant on that list? No. Nurse practitioner on the list? No. Physical therapist? No. But theology make the fucking cut, and chiropractic. Think about that for a second, right? If you want to study to become a chiropractor, you can get a $200,000 in federal loans. If you want to study theology, you could get a $200,000 loan. But if you want to become a nurse who's going to be in the ICU saving people's lives, you're capped at $100K. How does that even make any fucking sense? I'm trying to understand the logic here. What's the criteria? Because it looks like they just fucking threw a bunch of darts on the board and whatever fucking got hit, it made the list. There's tens of thousands nursing positions open in hospitals, and the Trump administration just made it harder for nursing students to afford their education. But if you want to study chiropractic medicine, you're good. Full $200K. The American Nurses Association is pissed. Their president said this restricts nurses' access to funding for advanced education and will prevent nurses from becoming educator and advanced practice nurses. And she's right. You know what we need? More nurse educators. More people who can train the next generation. This policy actively makes that harder. But hey, at least we'll have plenty of chiropractors and theologians with $200,000 in debt, right? That's definitely what we need during a healthcare crisis. This is what happens when people have no idea what healthcare looks like, write policies. Nursing isn't a professional? Tell that to the nurses who kept people alive during COVID. So we just talked about how absurd this list is. Now let's talk about what cutting nursing student loans access actually looks like. Because this isn't just insulting, it's going to make our healthcare system even worse. We are currently in a nursing shortage, not a small one. Tens of thousands open positions that hospitals can't fill. This has been a crisis for years, but with a huge asterisk. During my research, apparently a lot of these positions are open because nobody wants to go work there because they're going to be underpaid, understaffed, and a very high chance of losing their license. So keep that in mind when people keep telling you that we have a lot of nursing positions open. So what does Trump administration do? They make it harder to become a nurse. That's the policy. Advanced nursing degrees are expensive. Graduate level programs can cost up to 6 figures. If you're capped at $100,000 in federal loans, you're either taking out private loans with the worst interest rate, or you're just not going to nursing school. And you know who that affects the most? Women. Nursing is over 90% female. So is counseling, social work, all female dominated. The fields that made the cut, medicine, dentistry, law, all have higher percentage of men. So this policy disproportionately hurts women. Whether that was intentional or not, for sure is intentional, that's the effect. And it's not just about individual students. When you make it harder for nurses to get advanced degrees, you get fewer nurse educators, fewer people teaching nursing students, which means fewer nurses get trained, which means the shortage gets worse. It's a literal feedback loop. Think about COVID. Who kept the hospitals running when everything was falling apart? Nurses. Who worked 12-hour shifts with inadequate PPE? Nurses. Who held patients' hand when their families couldn't visit? Nurses. And now the Trump administration is telling those same nurses their profession isn't professional enough. This really pisses me off because we know what's going to happen. The shortage is going to get worse. Hospitals keep struggling. Patient care will suffer even more. And then politicians will wonder why healthcare outcomes are declining. This takes effect July 1st, 2026. If you know anyone thinking about nursing school, they need to know about this. This is what happens when you let people who don't understand healthcare make healthcare policy. They see a nursing shortage and think, let's make it harder to become a nurse. It's a genius move. If you found this video helpful, please subscribe. I cover these type of topics every single day. And if you want to support me directly, the link's in my profile.